I will share with you our use case from Czech Republic, from University Hospital Olomouc. We are three to fourth biggest hospital in Czech Republic, and now we are with the Ministry of Health trying to electronize all healthcare in the country. And in our hospital, we started a project which is based on IHE standards. Maybe I will skip it. Everyone here knows what is IHE, but in Europe it is quite new. In Czech Republic, we were first hospital which actually accepted or started the project within the IHE standard. And it was also recommended standard from European Commission. It's from 2016 or 15, which was recommended as a useful standard for exchange information between states. And now we are implementing also within the Czech Republic the IHE Gazelle testing tool for testing the interoperability for EHR systems in university hospitals or in hospitals generally, and in region governments. There are some examples. We just inspired in Austria, in Elga, because they started 10 years before we just mentioned about EHE standards, so they have a lot of work done. So we inspired from them, and they have such a big experience to connect the big hospitals and also GPs, etc. And of course, there are some other countries that are now implementing or about to implement. This is our approach and strategy. The Czech healthcare digitalization is coordinated by National Center for eHealth. It is part of the Ministry of Health, and the long-term strategy, which is based this electronization based on this strategy. And we also adopted the Act number 325 for implementing and accepting the electronization of whole healthcare in Czech Republic. And all these projects are funded by National Recovery Plan. It's some special fund after the COVID, and the target date for full production is half of 2026. So we have lots of work to do. So this is the infrastructure and integrated ecosystem, which is the core is integrated data interface. There are some registries which are mandatory registries and certified registries. Common data standards. We are now switching everything to FHIR, EHE for transport, and of course the SNOMED and LOINIC. There are some Czech maybe standard as well, which will be transformed to that standards. And portal and API services ensuring access interoperability, shared medical records. It should be state or based on only one platform. Now it's somehow distributed within all countries or region in country and hospitals. It should be the e-requests, vacation records, they are already set, and diagnosis, medications, and lab results should be shared across all hospitals and across all regions. So, terminology server is one of the project of electronization. FHIR interoperability profiles. As I said, we are now under the directive or the future development of EHDS, European Health Data Space, which would be or will be mandatory for all European countries to share all the data for secondary use, especially for research and development. And also very important for European Union, according to GDPR, is mandate and consent management, which is very important part of this whole project. So benefits of the system: so streamlined healthcare workflows, reducing paperwork, that's obvious, transparent patient access to their oral health information, and interoperability, as I said, across all systems and regions, and readiness for AI and research use cases. That's a very mandatory case, and I will show you how it works. So this is the case if we want start any interoperability. This each box is one region in Czech Republic. There are only examples of 4 regions which should exchange the patient data, and now is the standard spaghetti system, which is not the best solution for that. for that situation. For example, if you need change any EHR system in a particular hospital, so you have to switch all these connections within all other hospitals or regions or private hospitals with the whole country. So this is the bad solution, and now this is the plan. This is the architecture of the standardized approach, and this is using the EHE standards for exchanging data, cross-domain patient search, and now is about to start such a system in Czech Republic. I will just switch it. There are some the common standards or common services which we will be using. And it's also important to say this is no fixed to one only vendor. It's open for all vendors which are able to fulfill the standards, which are international and which are probably used or will be using within whole Europe. I will switch this. This was some use case. We just 2 years ago finished this project, and we just proved that it could work between our and some cardiac center in another city, in another hospital. In holiday days, we can switch patients very easily, so we can get the data from the patients from another hospital, and to get the all recent data and history the patients which were observed in another hospital. So it was a good example. This is the use case, patient sharing between cardiology. It was especially for cardiology, University Hospital are in another city, yeah, as I already said, it's just testing, and now it was the proof use case how to start another interoperability in Czech Republic. This is some picture. As I said, it was 2 years ago finished, and this is classic or typical hospital information systems. Big hospital information system. There are some EHR system, pharmacy laboratories. There are the inside very important systems, and also around are some registries, regional one or the states one. And on the top of that, it was the results of all these projects, and that it was the portal for clinicians, for GPs, especially in our region, and also for patients. And it's already working, but still we don't have all the data in a standardized form, and it should be done end of or half of next year. So we are prepared. Now we have switched all this communication, the internal communication is switched to some kind of internal standard of healthcare UCR, so which based on EHE profiles. This is the example how you can see the master patient index, for example. There is some timeline. This is the clinical internal portal for getting all the data in one place in document registry and the document repository within healthcare. This is also the lab results, admission reports, and the PACS DICOM pictures. So what components we were using? So we are still using its unified care record, of course, a FHIR CDR server, which is still preparing now for the switch from CDA. Now it's in Czech Republic working the CDA for country exchange patient summaries, and now we're switching to FHIR. The patient index, master patient index, which is also in standardized way, now it will be enriched for national new register, and of course the EHE affinity domains and consent management. So what next? What's next? Once we have all this data stored in one place, but still they are not structured in the proper format. They are unstructured. Mostly of them are unstructured data. So it's a little bit pain, but more pain it was before the GenAI comes. Because it costs very much time to consolidate this data, to try to transform this data within the healthcare. But now, once the GenAI is here, we can help to structure the data very easily. For example, if doctor needs some overview of patient's health status, including data from electronic health records, laboratory information system, we got 5 laboratories and 2 laboratory systems. Wearable device, for example, if you have some remote monitoring, telemedicine, or something like that. So you can all store unstructured in one place, in one store, and you can try to vectorize this data, try to create a structure for the future use, as I said, EHDS, which should be in a FHIR standard, and I need to search the proper quest for this multimodal data. So, for example, if I have such a query, I need to see the last 3 months of glycemic values for specific patients and related lab results for patient, currently specific patient which name is Novak. And the processing is queries embedded into vector space. Just Victor told about it in the last session, previous session, and I can see the glycemic values last 3 months for patient Novak. There is some vectorized information, and then I'm using semantic search across vectorized health data, and I can get, for example, that result. This is the artificial result because I can get these results in a specific FHIR standard. It's not a problem. This is another use case which we are now piloting or are about to pilot, is to create this vectorized unstructured data to specific structure format. In our case, it's a FHIR. So, insights from AI module: elevated average glucose in the past 3 months, plus 10% with previous period. Consider adjusting basal insulin dosage. This is some add-on. What can the AI or Gen AI add to the specific search criteria? This is another example which we are testing. Find me the patient's age between 45, 65 with type 2 diabetes, which ABH-A1 above 8%, and no history of cardiovascular diseases. And I can extract this data from the vector database, as I said before. The system used vectorized representation of the query and export also this to the FHIR format, FHIR standard, or whatever interpretation you need. And also you can get, it's just a suggestion. You can get some inner insight from Gen AI, because you get all the context included. You have all the history of the patients. You have some knowledge. You might have some RAC model which is connected. For example, the latest clinical trials for the specific criteria or disease. And you can get this insight at more. And this is that's just example how you can quite easily, we will see how easy it will be, how you can easily transform this data. Maybe if you noticed in some previous slides, it is really unstructured text. It's a plain text, just like you write it in a type machine, because our information system, or EHR, is 25 years old, so we are not able any structure to data. So it's really the smart typing machine, and we can via the Gen AI, and once we have all the data stored in one place, we can quite easily transform the data for that format. This is the example of FHIR, for example, for the specific patient. So that was all from me. If you have any question, please ask. Yeah. Okay, I will repeat. The question was about the EHDS and the preparation of that mandatory development. So EHDS, European Health Data Space, now it's about to start the preparation for legislation. We have to adapt, each European country should adapt this regulation in our legislation process. and it should be done, the first draft in 2027, and in 2029 should be done all the implementation, all the systems or EHR should be or must be in a specific standard, in the fire standard, which is now in the process. So all the information system, all the providers or vendors for EHR should have apply of that standard, of the specific standard, and also the cybersecurity regulations, because we are in the NIS2 directive, which is hand-to-hand with that regulation. So I think the pressure would be for every provider, healthcare provider, very, very tough. Yeah, but the date is 2029 in every European country. She's not here. Thank you very much.